Okay, so this is part 2 of anaerobic adaptations. Okay, so most anaerobic athletes have large muscles, leading to an increase in strength and power. This tells us that anaerobic athletes need to train to strengthen their muscles. Some long-term adaptations to anaerobic training are an increase in power. From the graphs on the screen, we can see the results for 2 wing gait tests. We can see that at the start of exercise, both the athletes start at a high power, but then the levels decrease during the test. This tells us that by using HIIT anaerobic training, we can increase the time in which the performer has a higher power. Some other adaptations include an increase in athletes' size of the fast oxidative glycolytic and fast glycolytic muscle fibers, meaning they perform hypertrophy and become stronger. This also happens to slow oxidative muscle fibers, but on a much smaller scale. Also, the percentage of fast glycolytic and fast oxidative glycolytic muscles will have increased, and the percentage of slow oxidative glycolytic muscle fibers will decrease. Some anaerobic athletes may also train to improve their muscular endurance and their muscles' resistance to the buildup of lactic acid. Sprinters will want to improve their muscular endurance so that their muscles can work at a higher force for longer without becoming as tired. These athletes also build up lactic acid in their muscles as a result of working anaerobically. So athletes train to delay their accumulation of lactic acid, which we'll talk about later in the video. HIIT training also improves an athlete's tendon strength and force generation, which is important in anaerobic activities. Anaerobic athletes will also train to improve their reaction time, as it may help them at the start of a race. One adaptation of neuromuscular is increased impulses being sent through neural pathways. So basically the impulses are sent faster and therefore the muscles react faster. Proprioceptors also detect quicker, and anaerobic athletes mainly recruit their fast glycolytic and fast oxidative glycolytic muscle fibers and barely recruit their aerobic, as they're not really used in anaerobic exercise. Anaerobic training works to improve everything, including your energy systems. There are 3 main systems that you use during anaerobic activities. These are your ATP system, ATP-PC system, and your glycolysis system. When using the ATP-C system, anaerobic training can lead to little change in the enzymes that are used, but with ATP-PC specific training, for example, a 100-meter sprinter, where it takes about 10 seconds, it will help them to increase their strength. However, when using the glycolysis energy system, after training there's an increase in the anaerobic enzymes, phosphorylase, PFK, LDH, and hexokinase, which can also lead to an increase in strength. The graph on the right shows an OBLA graph, which is the onset of blood lactate accumulation graph. This graph shows us at what point the athlete begins to build up lactic acid. An anaerobic athlete is likely to train to try and delay the point at which the lactate begins to build up. This is because lactate can be painful and can make it really difficult to continue if too much is produced. Therefore, athletes will train to try and delay their lactate accumulation. HIIT training can also help these athletes tolerate the lactate better, so that when they perform, they can push through and achieve a better time. Lastly, your basal metabolic rate is the number of calories that your body needs to keep you functioning at rest. To work out your BMR for a man, you would take 647 and divide it by 6.24 times your weight in pounds, then divide that by 12.7 times your height in inches, and then minus that from 6.755 times your age. And for women, it's slightly different. You can see it's 655.1 divided by 4.35 times the weight in pounds. Divide that by 4.7 times the height in inches, and then again minus by 4.7 times their age. BMR is known as your body's metabolism. So the greater your muscle mass, the higher your metabolic rate. If an anaerobic athlete adopted to having a higher muscle mass, it will reduce the body's weight and help you to burn more calories. This means that the higher your metabolic rate, the more fuel is burnt. Athletes will train to increase their metabolic rate, BMR, by training and losing fat. There must be an increase in muscle mass when athletes burn fat and they produce more energy even at rest. The graph on the right shows an athlete's blood lactate values at rest and after exercise. We can see that after the 20-second Wingate test, the athlete has produced a high amount of lactate, showing that they're working anaerobically. Anaerobic training can also have some long-term adaptations on the skeletal system. The training can help to increase the bone density of an athlete, making their bones stronger. This increase in density can also help to prevent osteoporosis. This can be seen on the picture on the left. This increase can help to prevent osteoporosis, which is the loss of bone density, making your bones more susceptible to breakages. Anaerobic training can also help with joint health and the range of movement in joints. The training helps to strengthen the cartilage, ligaments, and tendons at the joints, which help to prevent arthritis and hip fractures. Arthritis is where the ligament, which usually cushions the joint, wears away, causing pain, and hip fractures mainly occur in the elderly when they're unable to train and their bone density weakens, making their bones more susceptible to breakages. Too much overtraining, so training with little rest or little to no rest, can result in injuries such as tennis elbow, which is a cartilage injury, which could mean that you can no longer train, introducing reversibility. This is when the athlete can no longer train, so their strength and endurance and everything that they've built up begins to deteriorate back to what it was before, and they have to start again. Although training does help to increase the range at joints, for example, a 100-meter sprinter will train to increase the size of their stride, which means that they can travel further faster. By stretching out the muscles, the athlete is reducing the force from the unstretched muscles that would be pulling on the bones, not allowing the legs to stretch as wide and increase the stride length.